so I'm not sure if I understood your objectives here. So maybe I'll ask some of the questions and give us something to think. I'm involved in NLP, neuro-linguistic programming, and that's the models that have been created with NLP are more to do with mental and emotional health. So the physical side is something that I'm very interested in. That's why I'm connected with Daryl to find out more about it. Another thing that we get in NLP is that nobody is broken, everybody works perfectly. So in the case of a schizophrenic is working perfectly as a schizophrenic. If they want to integrate into normal society, then it's hard for them to find a process of moving from where they are to where they want to be. There's also one of the things that made NLP famous is that it turned traditional thinking on its head. So instead of looking at the problem, the diagnosis, it said, well, let's forget about the diagnosis and just get the person to where they want to be. And this is, if I may use Darrell's example, he went through a lot of doctors who couldn't diagnose him. They came up with diagnoses, gave him different medicines. But eventually he came up with one guy who said, I don't know what's wrong with you, but treat your whole body, treat your health, treat yourself through acupressure, which gives energy to all the different organs in the body. And then by treating the whole body, you will get better. And that's a process that tends to happen in NLP. Rather than worrying about what's wrong with the person, just find out what they want and help them to get there. I'm also, this is addressing the first point of the four, getting the diagnosis. If we're more focused on the diagnosis rather than getting the person to where they want to be, then we're doing something similar to what Darrell was saying in terms of medicating the person, giving them medicines, traditional, what we call now traditional medicines, which treat the symptoms of the disease, not cure the disease. So we don't want to treat the symptoms, we want to cure the problem. Also, another thing that struck me was the fourth point, which was build a continual relationship with the patient. Saying a patient implies that the person is still ill. If you cure a person, you don't need to have a continual relationship with them. And the relationship itself doesn't exist. You can't be a relationship in your hand. It's a process of relating to the client. And again, coming back to the difficulties of diagnosis, if we had maybe a way of educating the client or the patient to be able to better explain to the doctor what is happening to them, then it might be easier for the doctor to make that diagnosis. So if someone says I've got pain or acute pain, how do they know the difference between pain and acute pain? So a little bit of education about exactly where the pain is rather than it's generally in this area can help the patient actually pinpoint exactly what's going on with them. Then it will be easier for the doctors to make those diagnoses. So maybe those are some things to think about. Hope I've understood general objectives. Okay, thank you.
I got this wonderful opportunity of hearing almost all, so it's even better for me to be talking now. So I happen to be a physiotherapist, and I love a lot of interaction. So can I take 2 minutes where I ask a question and I will need answers? So if I ask a wide question saying that what affects your health, if you could just name some people's self-image when we discussed your case. Self-image, just because I'm walking with one foot in a block shoe and the other foot in a normal shoe. So self-image, how beautiful am I looking? Am I really looking young, or am I looking like a girl, or am I looking like a lady or an old lady? So self-image in society also affects our health, right? Okay, so this is about things affecting our health. Now, if I turn the question, what affects your happiness?
Nothing.
What affects happiness? Health. What affects happiness? What else? Can we name? Sorry? Loneliness. Loneliness. Okay. And?
Exercise. More exercise, happier you are.
The more exercise, happier you are, or the more exercise, healthier you are.
More money. Love.
Money. Love. Relationship. Has to do something with that mood and loneliness. We're pretty close, are we? So can we say somewhere that health happens to be synonymous to happiness? Health is so close to happiness. Is there any difference? I have really I cannot see any difference. All that affects health is exactly all that affects happiness. And if I have to turn the question, what affects your fitness? Maybe you'll come up with the same answers. So health, happiness, and fitness is all affected by the same factors. All affected by the same factors. I think we've answered how close is the relationship of physical body, the psychic body, the mental body. We are so closely related, isn't it? But who are the ones who appreciate it? Perhaps only the ones who have been healed with it. The ones who never experienced it, they just don't happen to appreciate it. So if we need to align the doctors with the healers, I would say, why not give the doctors a taste of this psychic therapy, and also vice versa, ask healers to mellow down with ego, also take a contribution from the doctor's therapy, and so that we happen to appreciate equally on a common platform, isn't it? Will that work? I suppose so. That should work, isn't it? Because to convince a doctor to say that please refer your clients for natural therapies, how should the doctor be convinced enough to refer the third one? If he has been healed himself, perhaps he'll be more confident referring his clients. If he's never tasted the healing part, he's only tasted medicines, he's never tasted healing, how will he be confident enough to convince his own patients to take up something which is so unconventional in today's world so far? Isn't it? For example, if I have to give my example, this was, I think, some 8 years ago. I'm anyways a chronic patient of polycystic ovarian syndrome, which is a very common thing to happen now. 40%, 50% females have polycystic ovarian syndrome, but it does a lot of mess in the lady's body, right from puberty till whenever menopause comes. So it's a hellish thing to go through. Now, allopaths have already told me there's no answer to polycystic ovarian syndrome. All you can do is when you're about to approach menopause, you can get your ovaries removed and your uterus removed, and that's the last thing that can happen. Okay, but for the daily trouble that I was going through, and I had already taken 2 years of medicines from the gynec and the endocrinologist, and I realized something else needs to be tested out now, is when I visited National Institute of Naturopathy in Pune. And I happened to visit it not by choice. I didn't walk in. It was just that it was neighborhood to my hospital, Ruby Hall Clinic. So I just walked in because I had to spend a month and a half there in that city. So I just went to explore. And I said, see, I have a trouble like this. Do you think you have an answer? I mean, I was still doubtful. I just casually out of exploration asked. And they said, okay, whether we have an answer or no is what you answer us back after you have can be addressed to by any one of us, or maybe all of us.
Why postpone it for the next thing? Why can't we do it with this itself?
We got still one more day tomorrow.
So
let us have a hands-on feeling. There should be something so that we can see if out of 10 even one says that okay, I'm feeling very much better. End of the day, it is building confidence in us.
Of course.
Otherwise it is all hot air.
Yeah. And if we have one doctor each coming new, and this one is convinced, we know that we have 10 more ahead. Oh, now I hand over to Princy.
Hi everyone, my name is Princy. I'm neither a doctor nor a healer. I am a dance and fitness instructor from Panjim. I've recently got into this industry. Recently shifted to Goa. I was in Mumbai before this and in Ahmedabad. So my roots are from Gujarat. I will quickly give one self-example before we very quickly wind up. Very short story of my own short journey. But there were a couple of problems I dealt with, small ones. One of them I would especially like to mention here is when I made a move for my work from Ahmedabad to Mumbai. It was a change in city, change in stress levels due to work. I was somehow not feeling happy, things like that. All of a sudden I had a skin problem on my face. So tons and tons of warts came all over my face. So I rushed back to Ahmedabad to show it to my dermatologist. She gave me some tube to apply. 1 week didn't happen. Nothing, no change at all. Then I went again. She burnt it through some needle. I don't know what that process is called. So I underwent that thing thrice, and it has to be taken at a period of maybe 15-20 days. Okay, the marks kept on increasing, no healing at all. So that went on for 2 months. And I was 23, 24. It felt bad to see my face. I couldn't see my face in the mirror. It went that bad. Ultimately, with no change, I asked one of my friends to recommend a good Ayurvedic doctor in Ahmedabad. So I went there, he did a pulse diagnosis. So he said it in Gujarati, I will tell to you in Hindi. He said, "Bahut garmi hai, पेट में." So I was like, okay, so what should I do now? So he gave me 2 months medicine. Within 15 days, everything cleared. Okay, so then I asked him, should I continue with these medicines? He's like, yeah, maybe for 15 more days. So I was happy. But at the same time, I realized all these 2 months I was fighting, struggling with my own self so much. This entire shift that happened, so much of mental pressure. I consciously worked on my own happiness. So coming to the part which a lot of people mentioned here, if you're not happy with your own self, maybe the body will tell things to you in very different ways. So yes, I'm a believer of holistic approach. I am a believer in this integrated model. There is one more example of the thyroid levels in my body, but I'm still trying to heal it. So Daryl, congratulations for this model. I am completely game for whatever help I can be of. Thank you very much.
To post run all these experts, why can't one person, so maybe somebody like you, be in overall charge and just try and discern what the patient really needs? So they're not spending thousands of rupees, and then you are in overall.
Yes, that sounds like a good idea, and the only thing is the practicality of it. No one person has so much time and experience to cover all the aspects of health, and so that's why we look at a team having their own depth of experience in different fields to come together.
You can have a team, but still one
Yes.
person.
Now the thing is also is being an opinion only from one person. People also like to get another couple of opinions. Now it may look that there are 4 different healers or one medical doctor, one Indian therapist, one
But they
psychologist.
can go to different paths.
Yes.
start with, you contact
Yes.
them, you make the
Now-
relationship with them.
Right. Now what Dr. Firoza is suggesting that the patient can start with one person and then refer to the other. Now
You
practical-
refer them
yes.
gradually.
Now what we have are seeing most practical, because this is a tendency why we're trying to work as a team, because up to now everybody has a tendency when a person goes just to a medical doctor only, the medical doctor would like to first try out one thing, two things, three things and their best, so time goes in that. And then only after they're done with all their therapies and they cannot do anything, then they pass it on to the next person.
I'm not suggesting that you treat them. I'm suggesting you take the big sort of
Diagnosis.
Yeah.
First-hand assessment.
and then you gradually try and work out yourself what sort of other doctors can help.
That is, this is something that I do in my own capacity, but I know it has limits, and that is why I have to refer some of my patients for an energy healer or something else. And it may be my perspective, for a certain illness, it may be my perspective that the main cause is food, because I have got this background, and I may not keep a lot of weightage on the mental aspect or the energetic aspect. So going to one person always has got this bias that they look first from their perspective, and they may not have enough information of other modalities to even suggest. Now, like you're saying that I can suggest, but even I could be flawed in what would be the next best thing, or what would be the thing that would be most beneficial for this kind of problem. So that's why I feel more comfortable in working with 2-3 people together, because a lot of good perspective comes into that balanced perspective, whereas mine may be a little biased, oriented to what I have experienced in my life and what I teach. Yes.
How do you guarantee that the alternative healing practitioner is actually competent in that particular discipline? Because it's my experience that a whole lot of people do one-day workshop and are then certified this, that, or the other. And there's so many people in Goa, for example, who are so full of sugar. If there isn't any kind of certification, any standards to be held up to, any form of ensuring that results are consistently reproducible, for example, Arjun, I think earlier this morning was looking at Reiki, and what the question of what should it take 21 days? How long does an MD take to get certified? Exactly. Pretty much anything requires a huge amount of effort and discipline and persistence for you to actually get good at it. I have a problem with any situation where you are doing fit to deal with potentially fatal conditions on the basis of very short workshop. But doesn't necessarily mean that you actually apply your mind, because it's more of a love and cure everything and set up these vibrational frequencies for you to you don't actually have a panel that is taken seriously unless we have some way of ensuring that something has been done to control and verify that the specific practitioner is, as I said earlier, competent.
Yes, thanks for that question. Very pertinent. And so I will just mention briefly without. He was expressing his opinion about that there are a lot of healers and therapists and people who offer healing different kind of systems, and how can one trust that system Because before you go to experience something, you need to know how good it is, how well established that person is. And so he was talking about certification, which is something very important. When you get certification, that was the Dr. Eaglet answer. A lot of years. So it takes in that, once you have certificates, it definitely shows you've been working at it, you had the professional qualification for it. So certificates are good, that's what we accept also. But we also see the practical aspect of it, that after all the certifications, what is the remedy and how that healer therapist, what effect are they having on their clients and whether people are healing or not. So it's a combination of both. But yes, the point is very well taken. More of study, more of in-depth qualification definitely